So remember always that is whenever there is edema occurring, okay, whether it be pitting type or non-pitting type, whenever the word edema has been used, then certainly it is a case of the kidney deficiency, kidney problem, wherein there will be why is this edema due to? This is due to the loss of the proteins in the urine, okay. That means the protein urine proteins will be high, and in the serum it will be less. Since it is less in the serum, as a result of it, COP has drastically decreased. Due to decrease in the COP, the plasma that is present will get infused into the interstitial fluid. As a result of it, the body appears to be edematous, okay. So there are only two cases, that is acute glomerulonephritis or else nephrotic syndrome. In the nephrotic syndrome, it is just a severe case of infection wherein alpha 2 levels will be extremely increased and the albumin levels will be decreased. But here in this case, that is in the acute glomerulonephritis, both the globulins as well as the albumin will be lost a little bit, okay, little bit it will be lost in such a way that the AG ratio is not altered at all, okay. So that is the point you have to remember over here. And yeah, the blood urea will be increased. Benzidine test will be positive in this case. Benzidine test will be positive in case of the acute glomerulonephritis. Cardinal symptom, that is cardinal symptom of nephrotic syndrome is the just check the electrophoretic pattern. For this one you have to check about the edema, then followed by the benzidine test as well as the protein is there को check करो. इलेक्ट्रोफोरेटिक पैटर्न क्या हमने था डायरेक्ट से टिक मारा अक्यूट ग्लोमेरुलोनेफ्राइटिस करके बोल को. See here it is seen that it is the turbid one because bacteria are bigger. They make it the turbid, while while the virus is a very small thing, so therefore it will be very much clearer and colorless. And the cell count is very high in this case because the bacteria grow very rapidly, but here they have to acquire the host machinery, then they will have to break that host, and then they have to multiply, so it takes time. Therefore viral amount cell count will be increased, but here it will be drastically increased. And the proteins are consumed by bacteria. Even the sugars are very much highly consumed by bacteria. Therefore both of them will be decreased in this bacterial case, while it will be increased. Proteins are not consumed by any bacteria, they are synthesized by the bacteria. Viral proteins are synthesized, therefore they will be increased in case of viral meningitis. And in case the sugar, which will be the only source of energy, will also be consumed by the virus. Since virals are small particles, they don't consume much, therefore it will be slightly decreased, that's all. So here in this viral case all have one arrow only, and in this case there are three arrows or two arrows minimally. Based upon that, checking the values with correlating with this, we get to know that this is the case of the acute bacterial meningitis. And these three things are very much related to all the patients who are suffering from diabetes. That is, all of them will consume some kind of a tablet, that is the drug, and all of them are maintaining their diet. And the third one is they all go to physical activity. They have to do physical activity. Just remember your nani, that will be very much easy. That is DDP, diet, drugs, and physical activity.